Okay, so we're going to be talking a bit about checking glucose levels in this session. So what ways can you check glucose levels? What have you heard of?
Sensors.
Blood test.
Blood test, yeah. Does anyone know what that test is called, the blood test?
HbA1c.
Yeah, very, very close, Emma.
HbA1c. I got that wrong.
HbA1c.
Oh,
But
right.
we'll let you off.
I got it wrong the second time as well.
Yeah, so there's the HbA1c, the blood test. What other ways are there of checking glucose levels?
Sensors.
Fingerprint.
The sensors, so they can be called CGM, so continuous glucose monitors. So yeah, the sensors, we'll come back to that. Baxter, did you say something?
Blood test.
Oh, was it Banu?
Fingerprint test.
Finger prick testing, yes. So they're the three areas that we're going to concentrate on in this session. So we'll start with the HbA1c. So this is a key part of your health check, and that managing type 2 diabetes wheel that Hannah showed you, this is the yellow segment of that, the health check segment. So what does the HbA1c test measure?
The glucose in your
level.
blood.
The glucose in the blood.
Sugar.
Yes.
Over 3 months, the average.
Okay, hold that thought, Emma.
Okay.
So let me just bring up a visual. I'll move that out of the way. Bear with me 1 second. Here we are. So here is a visual of the glucose. So yes, the HbA1c shows how much glucose is stuck to the red blood cells. So the more glucose there is, so like this one on the right hand side that says high HbA1c, the higher the test will be. So the less glucose that is attached to the red blood cells, the lower the HbA1c will be. Does that make sense to people?
Yeah.
Yes.
And the HbA1c, that stands for hemoglobin A1c. So it's the red blood cell and how much glucose is attached. So how long does a red blood cell last for?
1 day?
1 day?
I don't know.
That's
That was just a
okay.
guess.
3
Michelle,
months. 3 months.
3 months, says Michelle. Yeah. Banu, what did you say?
I said 2 to 3 months.
2 to 3 months. So yeah, a red blood cell lasts for about 2 to 3 months. So thinking about that test then, how often do you think an HbA1 test can be done? So if we think a red blood cell can last for 2 to 3 months. Barty, what did you say?
3 months?
3 months? Yeah, what does anyone else think?
Every 3 to 12 months?
3 to 12 months. Yeah. So the HbA1c, it tells you what your average blood glucose levels were over the past 2 to 3 months. So how much glucose was attached to those red blood cells. So therefore, there's no point in doing an HbA1c test less frequently than 2 to 3 months. Does anybody know why?
Because there won't be any changes such a...
You might have some of those older blood cells still in your system, so that the test can be skewed. So guidelines advise that HbA1c test is done every 3 to 6 months, but that will depend on your own HbA1c level and the treatment that you are on. So that will depend to what your healthcare professionals advise in terms of how often and frequently you need to have your HbA1c. So as a minimum, everyone should have at least a yearly HbA1c as a minimum. Okay. If you could get your health maps out, so that's the one that looks like this. This one. So looking at this looking at the HbA1c on here, so we're just looking at the top line for now. We will talk about these other lines next week. Why do you think there are different faces on there? So there's different shades and there's different faces. What do you think this means?
One is where it should be okay, and the other one is where it's
That's high.
risky.
One is risky, one's where it should be. What does anyone else think?
I think different for the ratio, like weight and waist.
So we're going to talk about that in a little bit actually, but yeah, where we've got the happy face here and where it's lighter, this is where things are, I think it was Hemmer who said it was at less risky. So yeah, at less risk to the body when there are, the numbers are sort of towards this side, and more at risk towards the red side where the sort of the sad face is. But we'll talk more about that as we're going through. What is the recommended HbA1c to aim for, do you think? It might help if I keep that up.
Less than 48.
6 to 7.
So I should just say, if we on here, it's got a measurement of millimoles per mole and percentages. It's because some places use percentages. Most places use this measurement, the higher number, the millimoles per mole. So we're going to ignore the percentages in the brackets for now. So we're just thinking about these bigger numbers. So just the top line here. So the recommended HbA level to aim for. So for someone newly diagnosed with type 2 diabetes, the target is usually 48 millimoles per mole or less. For someone who's had type 2 diabetes for a longer time, the target is usually around 53 millimoles per mole or lower. Why do you think that you have a target?
Is that something to do with age related?
To do with age? Thank you, Banu. What does anyone else think? Why is there a target of HbA1c?
A target to achieve, and also to reduce complications.
Thank you, Michelle. So yeah, the research shows that keeping the glucose level within the recommended range for you helps lower the chance of health problems. So what you just said, Michelle. Would everyone have the same target?
No.
No.
No, said Kanak, and no, says Bhakti. No, so not usually. Everyone should have their own HbA1c target set from your healthcare team. What can your target depend on? What's going to be the varying factors of what your target depends on?
Is your weight, height?
BMI.
Weight and height, BMI. So things like your overall health, your daily routine and lifestyle, what matters most to you. So, you know, you are a factor in this of what your beliefs and wants are as well. Your risk of low blood glucose, so that's hypos. And if you are pregnant or trying to get pregnant, that would affect the target as well. So what I'd like you to do now is, if you know your HbA1c result, I'd like to invite you to plot on my health map what your HbA1c number was. So as I say, it's this top line here. So for instance, if your number was 60 millimoles per mole, it would be, you would put a little, like a little circle or a little star, sorry, around here where it's around 60. My pen isn't wanting to work for me to plot it on to show you. So visually, however it is that you would like to see, so a little circle or a little star where your number is. You might want to write what your number is there as well. So does everybody have their HbA1c number? No. So some of for some of you, it will be a case of you'll know what to do when you get your HbA1c result. But for those of you that do have your HbA1c, you can plot that on now. Hema, were you about to say something?
Yeah, like I'm using this new thing called Simplera, and it's showing it as 10.2 at the moment. But last week, when my food was different, it was down to 8.4, which is like really good for me. But
is this your sensor, Hema?
yeah.
Okay, hold your thought on that for a moment. So this is just the HbA1c number at the minute, but we'll come to your sensor in just a minute, actually, because that'll be
I know what it
helpful.
was last month. It was 10.1, and then 3 months before that it was 11, and before that it was 12. So it's coming down.
Okay, thank you for sharing that. Was there anybody here that did have an HbA1c that they were able to plot on?
I have one, but recently I don't know how it's worked out with MMOL or the percentage, but it's 6.2, so I presume it's a percentage.
Oh, so yours was this on like a blood test from your doctor, Barty?
Yes,
okay,
last week.
Thank you for
Yes.
sharing that.
Yeah.
Barty, were you about to say something?
Yeah, I don't know where to get it from. I've got no idea. Where do you get it from?
So for some people, they will get it on the NHS app. So if you have access to the NHS app from your GP, doctor, surgery, they should have uploaded them onto that. For others, they may need to contact the your GP directly if you're having issues of trying to find out what it is, and they'll be able to tell you that as well.
Okay.
Is there anyone who did know their HbA1c number who'd want to share what their number was? You don't feel like you have to, you don't want to?
Mine says, sorry, 7.1%.
7.1%, is that you, Banu?
Yes, yeah.
Okay, thank you. I'll bring this up. How do you feel about that, Banu?
Not very good. But when I went to see the doctor after the blood test, they said that is, normal range for you.
Okay. So they may be talking about the finger prick test possibly, because that's the lower number if it's not talking about percentages for HbA1c. Michelle, what were you going to share?
My last one was 55.
Okay, so looking on the health maps, that's sort of around here-ish. How do you feel about that, Michelle?
Well, it had gone up slightly,
Okay.
but they changed my medication from glycoside to dapagliflozin.
Yeah.
So now they've added, well, they said they should have added metformin at that time. So now I've started on metformin because obviously I want to try and get it down lower.
So for yourself, so what I'm hearing is actually seeing that visually of what possibly could have been the cause for you, or a factor for things changing for you. It'll be interesting for your next HbA1c. Now that's added in, you'll be able to see visually yourself how that's going.
Yeah.
Thank you for sharing that. Why might people have different results?
I think it depends on how the pancreas is working. The people will be on insulin. Resistant will be more than the others.
Thank you, Barty. Yeah, so if there's insulin resistance, there are different types of medications. Kanak, were you about to say something? I know someone was glowing up blue there.
Yeah, I think my levels were 7.9 the last time, and the time before that was 9. So
okay.
Mine's going down. So
how do you feel about that, Kanak?
I'm feeling quite positive about that because it's going the right way.
It's going the right way.
Yeah, I'm going down the right way, so
yeah,
doing something right.
Thank you for sharing that. So how do you think HbA1c might change over time? Is it always going to be the same?
No, it should go lower if you're taking the medications.
Mm-hmm.
So Hema, you're saying that in terms of medications, that's going to have an impact, perhaps?
Yeah.
Yeah.
And also the lifestyle, I think that might make a change to the.
Yeah, lifestyle. And those different varying factors are going to have an influence on what the HbA1c shows, just as Michelle demonstrated actually with her own HbA1c results, how medication can have an impact. What would it mean if your HbA1c goes below 48 millimoles per mole?
You become hypo, don't you? Hypo.
Become hypo? What does anyone else
Yeah.
think?
Feel dizzy.
That you're reversing.
That is
Yeah.
reversing. So do you mean by reversing as in it's going the other way, Michelle?
Yes.
Okay. So actually, it wouldn't be a hypo. So we'll talk about that in just a moment. So in terms of the blood test, an HbA1c that goes below 48 or anywhere towards this sort of end of the map really would be demonstrating that actually the blood glucose levels are within target range or well controlled. What would it mean if your HbA1c was below 48 for 3 months or more without needing medicine?
You're in remission.
Remission. So yeah, so that means that your type 2 diabetes may be in remission. And what do you understand by remission?
It's reversed, is it?
Yeah.
Reversed?
You don't need to take medication.
Do you say you don't need to take medication, Hema?
Yeah.
Yeah.
Yeah, so to have the term remission, you to have the label remission, you'd have to be not on any medication for 3 months and be below 48 to have the term remission. Yeah. But if somebody did achieve remission, does it mean it's gone forever?
No.
No.
It could come back.
It could come back.
Might celebrate really well.
Yeah, and that could be the case actually for some people. It might be, you know, oh well, I've achieved it now. But if old habits sort of come back or old lifestyle comes back, what's going to happen to glucose levels?
It'll just rise.
Yeah, they can rise again. So diabetes checks would still continue to take place even if you feel fine and you've achieved remission. So if that was a case that you've achieved remission, those checks would still happen. So how can some people achieve remission?
Sticking to their new lifestyle and having that willpower to continue the changes.
So for healthy lifestyle and willpower, Hema?
Yeah.
Yeah. In terms of what the evidence shows, so remission tends to happen through losing weight and making changes to diet. Yeah. So yeah, will everyone achieve remission, do you think?
No.
No, not everyone will be able to achieve remission, but the lower we are on the health map, the more well controlled glucose levels are, regardless if you're taking medication or you know however it's working for you. So now we're going to move on to checking your own glucose levels then. So I know, Hema, you have a sensor. Yeah. Is there anyone else here who checks glucose levels at home, either with a sensor, so a CGM, or finger prick testing at all?
Yes, I do finger prick testing.
You do finger prick testing. Michelle, would you like to share your experience of checking your own glucose levels?
So when I do it, or why I do it, or so originally I was given it when I was first diabetic and I was on glycoside, because obviously with glycoside there's the risk that you could have low blood sugars and have symptoms of feeling hypo. So I was checking my blood sugars twice a day. So before or when I got up, and either tea time or bedtime. It just depended. I used to alternate really, and then I still do that now. I probably still do it once a day, even though I don't need to with the tablets that I'm on, but just to try and see where I am and control my blood sugars. And then I'll also check it. Again, not all of the time, but sometimes after I've eaten something, just to see what the spike is of what I'm eating. And from doing that, I found that there were certain things that I couldn't eat because they were making my blood sugars go quite high. So I have eliminated those from my diet.
Thanks, Michelle. So for you, it was a really helpful tool to see what was what you were eating and what was affecting your glucose levels.
Yeah.
Thank you for sharing that. And so that's the finger prick test. And then with Hema, you wear a sensor so that you can check that at any point.
That's right.
Yeah, and would you
Yeah.
like to share sort of your experience of the CGM, your sensor?
So the sensor, I've had two. So one was from the doctor, and that was using, oh God, I can't remember what it's called now, but I've recently put on a research one, Simplera, and they've both worked very well. I don't miss the fingerprint, the finger pricking, because my fingers used to get very, very sensitive. And with carpal tunnel, it's even more worse. I find that the alarms are really good because they remind you, because I'm on 2 different insulins, it reminds me to have that insulin before my food, which is really good. And it tells you if you've missed it as well. So 2 days ago I was really bad with stress and that, and I just missed my doses. So, but I'm back on track again. So
Well, thanks for sharing that,
it's a
Hema.
lot better. Yeah.
It shows what a powerful tool that can be with the alarms and
Yeah.
So just to sort of show you sort of the differences, the finger prick test, so that's where you would physically sort of prick your finger and then use like a device similar to this, and it will tell you what your glucose levels are. And then is this similar to what you use, Hema? So there's like a little disc on your arm?
Yeah.
Yeah, so the CG and the continuous glucose monitor, this actually measures the fluid around the cells, and then that gives a good idea of what blood glucose levels are. So and they can be checked, as Hema was saying, at any point. So you can use an app or a smartphone to sort of check that throughout the day.
So just to come in again on that, in the evenings, my levels were very, very high, and I wasn't taking enough insulin. So they upped that at my last appointment, and now it's getting really good. Like it's leveling off at a normal level. But when I do feel it goes very low, I wake up and I find I have to go to the loo and then just have a biscuit or something just to bump it up a little bit.
Well, thank you for sharing that. So you'll find that actually that it's giving you a good indication of when your glucose levels are too low.
Yeah.
And I should say, because Hema is on insulin, so for some people on some medications, it can give you a risk of your blood glucose levels going too low. So for someone like Hema, having a sensor on the arm is a really good tool for knowing when blood glucose levels are too low and needs a bit more sugar for glucose. So how are the tests that you do at home, so either finger prick testing or CGM, different from the HbA1c done by a nurse?
So it's like a daily thing, isn't it? For me, it shows me when I spike and when I don't spike. And like, was it Michelle that said she knows now what affects her? So like this week I've had chicken in my diet, and when I have chicken, I find it harder to digest that. Whereas when I have the Karela and the veg, I'm a lot better.
So for you, again, it's for seeing how food affects you, you're finding that's a really helpful tool.
Oh, definitely.
Thanks, yeah, so if any of you like an analogy and are into football, this might be a good visual for you. So if you think of like the finger prick test is like checking the score of one match. So it tells you how your blood glucose level is doing right now, just like checking the score of a game. The CGM is like watching all of the matches on TV and recording them, and you're able to check what your glucose is now, but you can also look at what your glucose levels were throughout the day and even past days. And the HbA1c test is like the league table result. So it's showing what your team has been doing throughout the whole season, not just the one match. So if any of you are into football or visual, then hopefully that helps. So for yourself, Emma, just to let you know, on the second page of the My Health map, there is a section for you if you want to at any stage. You don't need to do it now, but to actually record what your you can record your time in range. So that might be something that you might find helpful in terms of your recording your CGM results.
Okay.
So we've sort of had a bit of a discussion about why someone might test. So for Emma and Michelle, they both said about food. Different foods can it can be interesting to see how different foods are affecting someone. So who would have to test their blood glucose results at home? What sort of situations would mean someone would need to test daily?
Is it diabetic too? Type 2?
Type 2 diabetes, did you say?
Yes,
Bartley?
type 2 diabetes, yeah.
Yeah, so obviously we're here with type 2, but those who are on medications that would make glucose levels go too low, and those who are type 1 diabetic who have to have insulin. So what is the glucose level to aim for if you're finger prick testing or checking with a CGM? Does anybody know what a healthy glucose level would be?
Is it between 4 and 6?
4 and 6 is Facti. Anyone else?
5 to 8.
5 to 8. So
Yes.
sorry, Banu, what were we going to say?
Below 8, 4 to 7.
4 to 7. Yeah, so most people aim for glucose levels between 4 to 7 before meals and below 8.5 millimoles per litre 2 hours after eating. So between 4 and 7 would be a healthy range, but 8.5 2 hours after eating would be acceptable. In your workbooks on page 16, there is more information around finger prick testing. So if you want any more information about that. And in terms of how finger prick testing relates to, or CGM, your sensors relates to your HbA1c, the more your glucose levels are in range when you check yourself, so if you do finger prick test or check with a CGM, the more likely your HbA1c will also be in a target range. So the more that's in range on a day-to-day basis, the more it's likely to be in range for a HbA1c as well. What things can make your blood glucose levels go up or down? What influences? Carbohydrates, yeah.
Stress.
Stress.
Overeating.
Overeating.
Undereating as well.
Undereating.
When you're not well. Like if you've got a bug or something.
Thank you. And I'd add to that things like medications as well, and what you eat and drink is going to have an impact on glucose levels as well, and how you sleep. If you're not sleeping well, that can have an impact on glucose levels. How might you see the impact food had on your glucose levels?
Sorry, can you say that question again?
Yeah, how might you see what the impact is on food on your glucose levels? When would you test?
It's just 2 hours after, isn't it? Like when you just before you eat and then 2 hours after.
Thank you,
Is
Hema.
that
So
right?
yeah, you
Yeah.
would check before having the food, so you know what the baseline is without eating, and
Yeah.
then you would check again 2 hours after. So if anybody did want to see how food is affecting, you would check before and then 2 hours after.
Hmm.
If you wanted to find out how physical activity was affecting your glucose levels, when would you test for that?
Isn't it
How
the
would you
same?
test?
Isn't it the same? Like,
Emma's saying the same. What does anybody else think?
I think again, it's
Probably
like
less.
4, isn't it?
So you would do it before, as you're saying, Banu, but you could then test actually straight after the activity. You don't need to wait 2 hours. Okay. So before we finish this session then, so what have you learned about checking glucose levels?
you can do it by pricking your finger or using the sensor or having a blood test every 3 months, if not at least once a year. Oh God,
Thanks,
I
Emma.
remembered that. Can't believe that.
Excellent. What does anybody else, what's anybody else taken away, or what you've is there anything that you think can help manage your glucose levels or your diabetes from this session?
I think, like you say, you can see the impact that food has, and then trying to keep it within that range of 4.4 to 7. And also, obviously, if it's going above 8.5, you know that the food is having a bigger impact on you.
Thanks, Michelle. So yeah, if after 2 hours, if it's 8.5 or lower, that's the body bringing down the glucose levels. But yes, if it was perhaps higher than that after 2 hours, you know, it might be something you want to think about in terms of how that food is affecting you. Okay, any questions or anything anyone wants to say before I bring Hannah back in?